name is Ashley Nunley, and I'm going to do a speech over the importance of vital signs and my 3 members of my audience.
Oh, was I supposed to say my name?
Okay. Okay, do you know your life components are all a part of your vital signs? Noticing the signs and symptoms of abnormal vital signs could possibly save your loved one or your life. The first one, the most important, is the blood pressure. It's important because the higher your blood pressure is, the higher the increased risk of your health problems. This is the blood pressure cuff, and in order to take blood pressure, you take the cuff and you line it up with the artery. States okay, so you'll place it here. You also take your stethoscope and you're going to place it on your artery here, as well as pump it up with this bulb. The first number that you hear on here is considered your systolic, and the bottom number that you hear on here will be considered the diastolic, and that gives you the blood pressure. The normal blood pressure is 120/80. It varies among different people. If the blood pressure is high, it puts an extra strain on your arteries, and it also causes as the arteries become thicker and less flexible, you could possibly have a blood clot. It also could lead to a heart attack, stroke, kidney disease, or dementia. The normal heart rate is 60 to 100. And you'll take your stethoscope. The apical is the most accurate, and you will place it here. And you listen for 1 full minute, and that gives you the apical heart rate. Let me see. The heart rate is the body's need to absorb oxygen and excrete CO2. If the heart rate goes past 100, then it's considered tachycardia, which could be caused by fever, anemia, hypoxia, and if it goes below 60, it's called bradycardia, which can be associated with hyperthyroidism. The respirations are the most important part, because airway is always the first thing that you're going to assess on a patient. The respirations are, you count the number of times that the chest rises and falls within 1 minute. Within 1 minute, and that is considered your respirations. Also, with the blood pressure, anyways, let me show you, just demonstrate actually, so that you can actually see on the blood pressure cuff. You can come close to me, actually. You take the bulb, and then you actually pump it up. You make sure that it's closed off. It's not going, Asha. Oh, hold on. It's real close to my face, huh? It's not going. Oh, there it goes. Okay, and the faster that you pump the bulb, it inflates the blood pressure cuff. And then you slowly release. And as it's released, the first number that you hear, again, as I stated earlier, is the systolic, and the bottom is the diastolic. Also, you're going to assess the patient's temperature as well, because a high temperature is what is associated with fever and illness, especially is important with children. In conclusion, the vital signs are vital to each patient whenever they come into the emergency room or wherever. It gives you clues onto what could possibly be happening within the patient's body. So the normals, again, for blood pressure is 120/80. The respirations are 12 to 24. The apical pulse is 60 to 100, and the temperature is 98.6. Thank you.